Okay, so it's 1 o'clock, and so we'll get underway. And I'd like to welcome you all to this webinar on the 2021 census. My name is Nikki Bath, and I'm the CEO of LGBTIQ Health Australia. And I'd like to begin by acknowledging the traditional owners of the land on which we're all meeting. I'm on Gadigal land of the Eora Nation and pay my respect to elders past, present and emerging, and to all Aboriginal people with us online today. Please feel free to use the chat function to share where you are today. We are really grateful to the Australian Bureau of Statistics for joining us today to discuss the upcoming census. As you will know, LGBTIQ Health Australia has and continues to advocate for the inclusion of appropriate questions on sex, gender, variations of sex characteristics and sexual orientation. And we have been the leading voice on this issue, and we will continue to advocate for inclusion into the 2026 census. For now, we are advocating strongly for these questions to be included in as many health and wellbeing related data sets as possible using the ABS 2020 standard. I'm going to hand over now to Amber Loomis, our absolutely amazing policy and research coordinator, who will be emceeing the webinar. Caroline Deans, ABS Director of Census Content Review, will explain what the 2021 census will collect and what will happen to the information you provide. And I would like to thank Caroline for her ongoing assistance and support on the journey, which has been spanning many years regarding the census, and Nicole Capper from the Household Characteristics and Social Reporting, Indigenous and Social Information branch of the Australian Bureau of Statistics. I know it's going to be a really interesting webinar, and thank you again for joining us. Over to you, Amber.
Thanks, Nikki, and hi everyone. Welcome to today's webinar. As Nikki said, my name is Amber Loomis, and I'm the Policy and Research Coordinator with LGBTIQ Health Australia. I'd like to acknowledge that I'm zooming in from the lands of the Wadamadugal clan of the Darug Nation and pay my respect to elders past and present. This always has been and always will be Aboriginal land. Before I introduce you to our guest speakers today, I would like to mention just a couple of housekeeping items. Firstly, this webinar is being recorded and will be made available on the LGBTIQ Health Australia website. So if you miss any information and you'd like to go back and listen, that's where you'll be able to find it after today. Secondly, there will be an opportunity for you to ask questions, and we'll address those towards the end of the session. So as Caroline and Nicole are speaking, I'd like to encourage you to submit your questions using the Q&A function, which for most Zoom users is located down at the bottom of your screen. Now, with all of that said, we know that the census plays an integral role in developing services based on evidence and need. LGBTIQ Health Australia, and indeed many different community organizations, use census information to argue for better targeted funding and policy. Now, although the Australian government again set the 2021 census without questions on sexual orientation, gender identity, and sex characteristics, we are optimistic that in the future, based on the progress that's been made for collecting health data, that there will be improvement on the census in the future. So today, we're here with the ABS to learn more about the census and its importance, and to hear more about those ABS standards. So without further ado, I'd like to pass over to our first speaker, Caroline Deans. Caroline.
Thank you very much, Amber, and thank you to Nikki for that introduction. And as always, thanks to LGBTIQ Health Australia and for organising this webinar today. And for everyone who is joining, thank you for your interest in the census. I assume that is why you are here. My colleague Nicole and I hope to be able to answer the questions that you have about collecting data on LGBTIQ people, and I'll go first talking about the census, and then Nicole will talk about the statistical standard. I will also start with an acknowledgement of the traditional owners of the lands on which we meet, and I'm dialing in from Brisbane, so I'm on the land of the Turrbal and the Yarraga people, and so I pay my respects to their elders past, present and emerging, and of course acknowledge any Aboriginal and Torres Strait Islander people who are joining us at this webinar today. I'm sure you do all know by now that the census is on again very soon. In fact, it's on next Tuesday, the 10th of August. Amber gave a great introduction on the importance of the census. So part of my job is done, but I did just want to re-emphasize that from an ABS perspective, to say that the census is one of the most important sources of data that we have on the population. It presents that 5-yearly snapshot of who we are as a nation and how we have changed over the last 5 years. And haven't the last 5 years been quite eventful? So I would say that the upcoming census is probably one of the most important in most of our lifetimes. The census is quite comprehensive and it does have a range of topics. It asks about our age, where we live. There are some questions about our cultural diversity, our education and employment, and where we lived a year ago and 5 years ago, to get a sense of who's moving around the country. And I'm sure we'll see some interesting changes in that data in the current census due to the pandemic. The census data is very widely used. It's used by governments at all levels, but it's also used by businesses, both small and large, and it's used by a lot of community organisations. And that might be to help them advocate better for their community, to better understand how their community are dispersed, or how to deliver services and support to their community. This time, we are adding some new questions to the census, and it's been the first change since the 2006 census. And I led the team that came up with new topic recommendations and developed the questions that you'll see on your census form when you complete it. And the 2 new questions are long-term health condition, which presents a list of common long-term health conditions that you select from, including mental health conditions, and also a question about service with the Australian Defence Force. And that service that is both a current service, but also a previous service, to help identify our veteran populations around the country. Questions on sexual orientation and gender identity will not be included in this census, but they were part of the shortlist that was presented to government, a shortlist of topics that we received interest in from a quite extensive consultation and engagement process that we did. We came up with 8 shortlisted topics that we then further assessed. So I'll just be clear that the role of the ABS is to make recommendations to government on what should be included in the census. And those recommendations include the pros of particular topics, but also the cons of particular topics. And that was a recommendation that we put to government. And on this occasion, the government decided not to progress the topics on sexual orientation and gender identity. But we did progress very well with understanding how to collect data on those topics. We did a lot of research involving members of LGBTIQ plus communities, and that's through focus groups and also one-on-one interviews, and also interviews and focus groups with many other respondents from across a range of communities in Australia, or a vast range of age groups, different cultural diversities, and out in quite remote parts and far-flung parts of the country. So we gathered some good evidence on how to collect particular questions in the census, including really comprehensive assessment of the gender identity and sexual orientation questions. And that's, I think, stood us in very good stead for producing the standard, which Nicole will talk about later. And I'm quite aware that there is a lot of interest in collecting those 2 topics on the census, and the campaign is already underway advocating for inclusion of those topics in the 2026 census. One question that is changing in this census is the sex question. And I want to spend just a little bit of time talking about that because I know that it is causing some confusion. We have got more information on our website, census.abs.gov.au, and we also, I know that LGBTIQ Health Australia are putting together a set of frequently asked questions to provide advice to members of the community, or provide guidance to members of the community on how to answer that question. So let me just be very clear that the 2021 census is collecting information on sex, and that's what we have collected in every census. We are not collecting information on gender identity because we're not permitted to collect information on gender identity as a result of those recommendations to government. And so for the purposes of the data collection in the census, there is a clear distinction between sex and gender. And I know that distinction doesn't necessarily align with everyone's experiences. And I know that this is a sensitive topic and a difficult topic. So I'll go through the intent and the principles of the question so that you can use your own judgment in how you are going to answer it when you do participate in the census. In a moment, I will put up screenshots of the question to illustrate what I am talking about. So the wording of the responses for the sex question, there are 3 of them. It's male, female, and non-binary sex. And non-binary sex, that 3rd category, is intended as an option for people who wish to report their sex as other than male or female. And our terminology here is intended in the technical sense of the word, that is non-binary, not in the binary of male and female. So it's not in reference to how people may express their gender. And I know that is a tricky terminology to use. When we talk about sex, I've made it quite clear we're talking about sex and not gender on the census. And when we talk about sex, we're defining it or describing it as referring to someone's sex characteristics, specifically referring to their chromosomes, their hormones, or their reproductive organs. So I encourage you, when you're completing the census, to have a look at the question and think about how that applies to you and respond in the way you see best, whether that be male, female, or non-binary sex. I will just try and get this screen sharing work, and I will pop up the question. Where am I? Over here. Excellent. I think I'll press that button, and I think that is working now. Okay, good. So as you can see at the top of the screen is the wording of the question and the terminology non-binary sex. These are marked as boxes, check boxes, which means that you can respond with more than one. So it may be applicable for you to answer both male and non-binary sex. It may be applicable for you to answer female and non-binary sex, or you may just answer one of those 3 options. Male and female are mutually exclusive, so they can't be selected together. For someone who does select non-binary sex, there is an additional text box that appears, and that provides an opportunity for you to enter in text to explain what your expression is, or how you'd like to describe your situation in terms of sex. So if you are ticking non-binary sex, I'd encourage you to put some comments in that text box. And I've just finally got the snip of the paper form, just 3 simple check boxes on the paper form. So the text option is available for the online form. I'll just stop sharing my screen now and talk very briefly about the data from the census. The main data that will be released from the census is going to occur in June 2022. So it's about 10 months after we collect census data, we actually release the vast majority of it. And the only things that we don't release are those that are a little bit more complex to process. And they include things like our employment data and internal migration. That is where people have moved around over the previous few years. The range of products that we will be releasing from the census are very similar to what we did in 2016. So there will be web pages, producing just snapshots, spreadsheets that provide a lot more data, and then a table builder product which allows you to construct your own tables. And all of those will be available for multiple geographical areas, right down to suburbs and below, so your areas of interest. Now, in terms of the sex question, the main release from the census will present all sex data as male or female. It won't include that non-binary sex question, sex response. But after the main releases come out, we will be releasing conceptual and analytical papers to explain more of what we've seen in the data. And that will include papers on how people have responded to the non-binary sex question, and will include an analysis of the write-in text responses, but that won't be part of the main output from the census. And I want to be very clear that we don't believe that the data collected from this question in census will present good quality data of intersex people or of trans people. It is unfortunately not intended to do that. To be able to get that good quality data, you actually need to ask multiple questions about someone's sex, about their gender, about their intersex characteristics. So the data from the census should not be used as any proxy for a number of trans people in the community, for example. And we are very aware, we've had many discussions with Nikki and her team and with others about the misuse of data that can occur and did occur in the 2016 census. So when we are releasing our data from the census, we will do so in conjunction with Nikki and her team to understand how that might be received and to get best guidance on how to express those numbers, because I know that the regular quoting in the media and in Parliament and in other places of the census number from 2016 was very harmful, and we are saying quite clearly at the point of collection of data that this is not a count of people who identify as in a trans way, and it's also not a count of people who have intersex variations. But as I said, the way to best capture data of that nature is to include the questions from the standard, and it's a multiple set of questions. So I might finish up there and pass back to Amber, but I can see that there are a number of questions appearing, which I'll have a look at in a moment, and after Nicole's finished talking, I'll be happy to take some of those questions. Thank you.
Thanks so much, Caroline, and to everyone who is putting those questions through. We'll certainly respond to those here shortly. As Caroline has alluded to, the 2020 standard is often pointed to as an example of what can be used to standardize the collection and dissemination of data related to LGBTIQ+ communities. So I'm pleased now to pass over to Nicole Capper, who will speak more about these standards on sex, gender, variations of sex characteristics, and sexual orientation. Nicole, over to you.
Thank you, Amber, and thanks, Caroline. First, I would like to acknowledge the First Nations people as the traditional custodians of this land, Meanjin, upon which I work and live. I want to pay my deep respects to the Turrbal and Yuggera people, nations, and I pay my respects to their ancestors and elders, past, present, and emerging, and say thank you to any Aboriginal and Torres Strait Islander participants today. So to start with, my name is Nicole Capper. My pronouns are she, her. I've worked across various projects relating to sex, gender, variations in sex characteristics and sexual orientation over the last couple of years, beginning my my journey with Caroline in the 2021 Census Content Development arena. And more recently, I've joined the gender statistics team to support them in their work for the implementation of the standard, which is what I'm now going to provide a bit more detail on. So the standard's full title is the Standard for Sex, Gender, Variations of Sex Characteristics and Sexual Orientation Variables. But because that's a lot of words, I'm going to just refer to it as either the 2020 standard or the standard from here on out. So the standard replaces, the 2020 standard replaces the one that was in use in 2016. I just wanted to start by acknowledging that the standard produced today that we are referring to was the outcome of a lot of work from a lot of different people, a lot of key stakeholders. We liaised with the sex characteristics, gender and sexual orientation reference group, which includes peak bodies, government organisations and members of academia. We sourced external advice on the best practice, both nationally and internationally as well, on the topics covered in the standard. And I want to acknowledge that this was a challenging process for everybody who was involved. The various groups represent obviously diverse and really important needs across the Australian population. And to be able to meet all of these needs and achieve unanimous agreement across a single standard was difficult and understandable. But it was a testament to all of those who were involved that we've been able to produce a standard of this quality. So what did we do in 2020? We've made some changes to the wording and response options for sex and gender to make them reflect contemporary Australian society. We have also introduced variables for variations of sex characteristics and sexual orientation, and created some information around the derivation for collection and output of cisgender, trans and gender diverse classifications. So the reason we did this is because every 5 years we do a major review of this standard. We did this to also ensure that all survey participants can see themselves in the questions and responses offered in surveys so that they're able to more accurately answer questions to reflect themselves and their lives. We've also done this to be able to support building a stronger evidence base on what our diverse population looks like. And the primary key approach to this is that with consistency of application across collection methods, we're able to build upon this data over time and improve statistics collected for the target population. So I'm going to share my screen now just to give you an insight into the actual standard itself. So just to let you know, what we've done throughout the standard is provide definition of the concepts and variables, and then provide best practice standard approaches for each of the questions. So I'm going to get savvy, I hope, and share this screen, I hope. Now. Okay. All right, so to start with, we've defined sex as the following. A person's sex is based upon their sex characteristics, such as their chromosomes, hormones, and reproductive organs. This is not the only component of the definition within the standard. We do provide a lot more detail in the standard and include that a person's sex can change over the course of their lifetime, and it may be different to the sex that's recorded for them at birth. So for sex, the sex question in particular, we have 3 questions. We have the standard question, which is the one that you can see on your screen, I hope right now. And we have 2 allowable alternatives. So I'll run through what you can see on your screen. So it's got here, what was your sex recorded at birth? And it's got 3 options to select from there. So as you can see, to start with, throughout this entire standard, we are encouraging people to use inclusive language. So as you can see in the brackets, we've included there to role model and demonstrate that this is the approach we would like people to take. In the 3 selections or response options below that, we have included another term as a third response option. And the reason we've done this is to recognise that across Australian jurisdictions and elsewhere, there's a range of options that are available on birth certificates. So this is to capture the population who has had that experience. This question only allows for a single response. It's not a multi-response field. And this is the specific question that should be used if this survey, if any surveys or any collection tools, vehicles are trying to establish and derive cis, trans and gender diverse counts. So this is the question that must be used in that scenario with the 2-step process, which I will go on to explain a little bit further down the track. So this being our standard question, the first alternative allowable question is very, very similar to what we've got here on our screen, except that it removes the term recorded at birth. So it is, what is your sex? The reason we've provided this allowable question is because there are survey vehicles that have collected this data over time, and this is to support the integrity of time series at this stage. As Caroline has already introduced to you, the second allowable alternative is the sex question that's available on the census. So now I will lead into gender. So the definition of gender is a social and cultural concept, it's about social and cultural differences in identity, expression, and experience as a man, woman, or non-binary person. So again, in the standard, we provide further detail about this, and we have additional text that states that non-binary is an umbrella term describing gender identities which are not exclusively male or female. Now, the gender question looks like this. So we've provided, this is an update from 2016. So the differences between this question for 2020 and 2016 are that we ask people to describe their gender. And we've also included in here the option to say that you would prefer not to answer if that's your choice. As you can see, the question has got, again, inclusive language. It also provides some context around what gender means, and then allows for 5 options to select from. Sorry, I'm just working from a couple of screens here, so please excuse me as I bumble around a little bit. Okay, so the next variable that we've included in the standard is a new variable. So these are our next 2 new variables that we've included in the standard. So the first one is variations of sex characteristics. So as you can see here, it refers to people with innate genetic, hormonal, or physical sex characteristics that do not conform to medical norms for female or male bodies. And as with the previous questions and definitions, we've provided further context, also referring to intersex and DSD to allow people to identify with this term. Okay, and the question for this, is this. So what we've all collectively come up with is, were you born with a variation of sex characteristics, sometimes called intersex or DSD? And we've got the 4 response options there to select from. Now, this question, it's really important that people understand that this question should be asked if this is the target population that people are wanting to achieve receiving data on. This question needs to be asked alone. It's not acceptable to have this question integrated into a sex question. This must be a standalone question. So it should be the question for sex, and then the question for variations of sex characteristics to have best practice and to be able to obtain the most accurate data for this target population. We've also noted in the standard that it's important that this question is only asked for self-reporting only, and that it's not appropriate for somebody to be answering by proxy for this question. Moving to the next question is sexual orientation. So as I mentioned, this is another variable that we've added into the standard. This question, or the questions about sexual orientation, have indeed been collected within the General Social Survey since 2014, but this is the first time that we've been including it into the standard. So as you can see here, the definitions that we've included in sexual orientation include sexual identity, attraction, as well as behaviour. So for the purpose of the question that we've asked, we focus on the concepts that are captured in the blue box over here. So a sexual identity and sexual attraction for the question. So the standard acknowledges within that responses to sexual orientation question are a subjective view of oneself, and that they can change over the course of a person's lifetime and in different contexts as well. So an individual can respond differently to questions on either sexual identity, attraction, or behaviour. So the question looks like this. So how do you describe your sexual orientation? And then we have 6 response options here. Now, this question, sorry, I'm just going to get my notes here. Okay, excuse me, sorry. The standard allows for further response options than those that are outlined here specifically. So those options include asexual, pansexual, or queer, and queer, to be added into the question response options. And as well as that, we can separate out gay or lesbian into their own response options as well. Again, this is recommended that this question is asked for people to self-respond to, self-report to, rather than being answered by proxy. So this question does differ from those included in the 2014 and the 2020 GSS. And the way that they have differed is that we use the term sexual orientation within the question itself. And we have changed the third last option, the 4th option, to I use a different term to make it more relevant and better to answer. Now, let me see. I'm going to go back up here for 1 second. Sorry. Now, I've referenced a few times here the cisgender and transgender diverse classification. So just to go a little bit further into that, as I mentioned before, the question is, this is a 2-step process. So the first step is to ask sex at birth specifically and explicitly. And the second question is to ask gender. So it's only from using these 2 questions that we can derive the population for cisgender, for transgender, and for gender diverse. So we stress that quite significantly when speaking to people about that. That's all I had around the actual standard itself, but I did want to add 2 more little notes into all of this as well. I wanted to acknowledge and emphasise the value and the importance of your submissions that came in through the census content development process. The intelligence that we were able to gain really strongly informed the standard review process, and it supported the ABS to respond in a way that we hope will benefit the collection of statistics on the various population groups represented in the standard. So we wanted to say thank you very much for your advice and your support. And I figure we're in the middle of the Olympics, so I have to make an Olympics reference. I feel like a bit of a Stephen Bradbury coming in at the very end of all the amazing work that's been done with our stakeholders and internally on this standard. And I just wanted to thank those who have been involved outside of the ABS, but in particular, I wanted to acknowledge the dedication and the commitment of the ABS staff involved in this standard, in the development of the standard. Andrew Moore, Kate Cox, Renee Hagaratz, and Clarissa Naprowski were all very, very involved and engaged in this process. So thank you all very much. I'm going to hand back to Amber now.
Thanks so much, Nicole. As it's been discussed, the 2020 ABS standard provides 4 questions around sex, gender, variation of sex characteristics, and sexual orientation. However, the 2021 census has only 1 question about sex. And so to start us off with our questions, I'd like to ask, I'd like to say that as someone who is non-binary, can you talk about what that actually means for non-binary people filling out the census and how that data might be used?
I'll just unmute myself, and Nicole, I think I'll take that one. Yes, so Amber, acknowledging, as I have said, that the census is only asking the one question, and a question that is not ideal for someone who is non-binary. So I can't give prescriptive advice to you on how to answer. I guess I can only give a general guideline and let you read between the lines and see what best applies in your case. So strictly when we are talking about sex, we're talking about a person's chromosomes, hormones, and physical characteristics. Now, of course, I know that those can change over time. And so I just encourage everyone, as they're answering the census, to answer it as they feel comfortable at this point in time, giving consideration to those attributes that we're using to describe sex. It's probably still a bit vague, and I have seen questions coming up on the chat. And I'd probably add to that by saying that there are questions in the census that are a bit open to interpretation. And the other example that we often see confusion around is the example of ancestry. If I come from a background with 4 different grandparents, what do I choose as my ancestry? And in some cases, we do leave it to the judgment of each individual respondent to answer in the way that sits comfortably with them. And I'm sure for those who have completed the census over many years, you answered in a particular way. And if that's what sits comfortably for you, I encourage you to keep doing that.
Thanks, Caroline. We've got another question here related to same-sex marriage and how that may be counted on the census. Can you answer that one for us, Caroline?
Yeah, look, that's a good question. It's actually a tricky question as well. So we don't ask questions about sexual orientation in the census, but we do ask questions about relationship within a household. So within a household, you fill in your form and you talk about the relationship that each individual in that household has back to the person 1 and the person 2. And if the people, say the number 1 and 2 people on that form, are of the same sex and answer that they are married or that they are in a de facto relationship, then that data is available. And in fact, it has been available since 1996. We first released information on same-sex relationships out of the 1996 census. Now, obviously back then, same-sex marriages weren't available in Australia, but this time we will be able to have people reporting both that they're in a same-sex marriage or a same-sex de facto relationship, and I think that will provide some really good insight into what's happened over the last couple of years since marriage equality came in. I'll point out the caveat of that, or the limitation of that only captures people who are living with their partner. So if you are not living in the same household as a person, then whether that is a same-sex relationship or an opposite-sex relationship, then that's not recorded in the census. But I will also point to, as I'm sure many people have seen, the ABS also does a data collection around marriages, and I know they have been reporting on same-sex marriages over the last couple of years. So that's the administrative data source on same-sex marriages.
We've also received a few questions about the paper form for the census and whether that includes a free text response.
Yes, so if you want to answer with non-binary sex and provide extra information, I really encourage you to do the census online if you can. When you look at a paper form, we're set up to scan in or capture data from millions and millions of pieces of paper. So it's actually a lot trickier to get text off of a paper form if we haven't provided a text box. So with the sex question on the paper form, there are the boxes that you tick. And if you write alongside that, we can capture that information, but it's a far trickier way to get that information. So I would certainly encourage you to do it online if you can.
Great. Nicole, we've had some questions related to the 2020 ABS standard and how they might be used. Do you have any examples of any surveys that are currently using the standards or intend to in the future?
Yeah, I've got a good little list here. So at the moment, the mental health study, and I can't remember its full name, I'm really sorry, is collecting information around sex at birth, or asking the questions, sex at birth, gender, variations of sex characteristics, and sexual orientation. The survey of disability and carers is also going to be asking sex at birth, gender, sexual orientation. The National Health Survey will also be collecting data on sex at birth, gender, variations of sex characteristics, and sexual orientation. The Family and Community Experiences Survey will be collecting data on sex and sexual orientation. And as I've mentioned before, General Social Survey collects on sex and sexual orientation as well. So these are all things that are going to be coming forward in the future, very near future.
That's great. And certainly part of the work that we're doing at LGBTIQ Health Australia is making sure that that standard gets implemented in as many national minimum data sets as possible, because that's really one step towards getting that better data for our communities. Absolutely. Now, in our last couple of minutes here, I want to thank Caroline and Nicole very much for your time with us this afternoon, and for everyone who has been joining in and engaging with the content today. I know there are lots and lots of questions that we haven't had an opportunity to get through, but we will provide a link in the chat to an FAQ document, which hopefully addresses some more of those questions that folks have had. And this FAQ document also includes some information on how people can get involved to influence change for the 2026 census. So Caroline, before we share the link for that document, can you talk a little bit about the process for engaging in the next census and how folks can get involved with that?
Okay, yes, so I could talk about what happened in the lead up to the 2021 census, as I expect the process for next time will be similar. And although we're yet to conduct the current census, we have had people starting working on the 2026 census already. It takes many, many years of planning. So I expect that the timing for formal consultation in the next census will be around late next year or early the following year. So let me get my years right. So we're currently in 2021, so late 22, but more likely early 23 is when review of the topics for the next census will commence. It's my recommendation to the 2026 team that they do a public consultation process again and actively engage with stakeholders. So our process this time was that we met with a lot of key stakeholders, key data users. That was across government, but also across many organisations. And we met for the first time with LHA back in 2018, early 2018. So this journey has been one that's been going on for several years. So I expect, yes, in early 23, there'll be a public consultation process and the start of engagement with data users. And the ABS will then review all the submissions and make those assessments. Then it comes out of our hands, because we make the recommendations to government. And I have seen things in the chat about the ABS being the government, and the ABS is a government department. We are apolitical. We provide advice, in this case, to the government. By that I mean the political party who happens to be in government at the time that this decision is made. So our role is to act in an apolitical way and present a set of recommendations to the government. The census needs to be included in legislation. That's why it's a political process, not a departmental process. So the ABS will again make a recommendation to the government. That government will then take those recommendations and pass it through the Parliament. LHA was very involved in every step and advocating very strongly during the consultation and submission process, during the government recommendation process, and then again through the parliamentary process. I expect that advocate groups, including LHA, will probably act on in the same way next time, but I do encourage members of the community to think about influencing government and Parliament on this, because they are the ultimate decision makers. In our recommendations, we clearly established that there is a data need for this, but it became, it was a decision made within politics. So I'd encourage you to think about the political response if you're keen on changing things for 2026.
Fantastic. Thank you so much, Caroline. And thank you to everyone behind the scenes who's helped make today possible. Thanks so much, everyone, for being here, and enjoy your afternoon.
Thank you, everybody.
Thanks. Bye-bye.